Dear children, good morning. Today we are going to study the second lesson in Civics. This is an appropriate situation to discuss the role of government in health. Since independence, major health problems like malaria, plague, tuberculosis, leprosy, smallpox, chickenpox, dengue, HIV, different types of flu viruses. At present, COVID-19 have been addressed through a strong action of the government. Health systems are fighting with the effects of communicable and non-communicable diseases and also with the increasing burden of emerging and re-emerging diseases. This lesson explains the public health services and private health facilities and compares the two models, that is Kerala model and Costa Rica of North America. What do people expect from government in a democracy? In a democracy, people expect the government to work for their welfare. This is done through the provision of education, health, employment, housing, development of roads, etc. Dear children, look at this quote from the Constitution. The right to health is an aspect of our fundamental rights. An important part of the Constitution says it is the duty of the state to raise the level of nutrition and the standard of living and to improve public health. Dear children, look at the highlighted words carefully. Standard of living means level of living of people at which they live. If they live in hygienic conditions, enjoying all the comforts of life, it means their living standard is high. On the other hand, if they are bound to live in a dirty surroundings and drink polluted water and eat unhygienic foods, it means they lead a low standard of living. The another highlighted word is public health. It refers to the health of the general public. Our Constitution ensures equal access to health to all without any discrimination on the basis of caste, creed, sex, religion, etc. Children, what is health? Health means the ability to remain disease-free. It means having clean drinking water, better sanitation, pollution-free surroundings, stress-free life, etc. What do you mean by healthcare facilities? Healthcare facilities are places that provide healthcare. Healthcare facilities include health centers, hospitals and labs for testing, ambulance services, blood banks, etc. Where does the government get money to give free treatment and to run healthcare facilities? The answer is taxpayers' money is used for providing public services like defense, police, judiciary, roadways, developmental programs like education, healthcare, employment, space, nuclear or missile programs, services to poor, etc. What are different ways through which the government can take steps to provide health care for all? We need healthcare workers, nurses, qualified doctors, medicines and equipments to run the healthcare facilities. Opening and maintenance of hospitals, healthcare centers, primary health centers, dispensaries, family welfare centers, free camps of checkups, free diagnosis centers, special campaigns like Pulse Polio, health awareness programs, workshops and seminars training camps, etc. Healthcare is divided into two categories: public health services and private health services. The public health services is a chain of health centers and hospitals run by the government. Private health facilities are not owned or controlled by the government. These services are run for profit. The cost of these services is rather high. Dear children, let me thank the unsung heroes of the nation. Extraordinary service by doctors and workers deserves our unending gratitude. These warriors have been working since the COVID-19 outbreak. When everybody is sitting home, the policemen, the doctors, nurses, plasma donors, pathologists, paramedics, teachers, researchers, and our soldiers are working in order to control the spread of the virus. Grocers, street cleaners, and emergency workers, restaurant staffs, sanitation workers, and ambulance drivers are working in order to control the spread of the virus tirelessly. The truck drivers hauling our essential groceries and medical supplies across cities and countries, government employees and administrators ensuring the seamless continuity of all basic services. Dear children, I would like to dedicate my today's teachings to the frontline workers in the COVID-19 battle. I hope you all could have understood my today's teaching. If there is any doubt, you can text me your doubts to my WhatsApp number. After watching this video, type thumbs up emoji in group. Thank you. Stay strong, stay safe, and stay blessed.